And we're back to Johnson County today on KOKO 909. And we welcome to the studio Darinda Reberry, who is the CEO at Western Missouri Medical Center. How are you?
I'm doing great. Thanks for having me.
Yeah, good to see you. I don't know a whole lot about you, other than you've been in the hospital for quite a while now, working there. Can you give me some information on yourself?
Sure. I came to the hospital, been 5 years ago now. I am a nurse by background. I grew up in Sedalia, Missouri. My whole family lives there still to this day. I went to college here at Warrensburg, graduated with my nursing degree in 1996. Lived in the Kansas City area, worked as a nurse there for about 20 years, and then came here in 2013 as a chief nursing officer. In 2015, became the interim CEO here at Western Missouri and progressed to the CEO in February of 2016. So I have been here for 5 years now.
Was that a goal of yours in the long run, to become an administrator as opposed to a hands-on nurse?
I love being a nurse. I love taking care of patients, and I was always I have actually lots of different kinds of experiences as a nurse. I was a float nurse early in my career, so I did lots of different kinds of things. But I did get into management around 2004, so I had been in leadership roles for several years. I worked for HCA most recently before coming here, and I was in a development program to become an executive leader. So I do like operations. I enjoy helping to make things better for patients through making the environment better for the practice of physicians and nurses, and just make the operations run better. It's something that I enjoy.
If you could hang your hat on something over the hospital right now that you've accomplished, what would it be?
My most proud accomplishment that we have done is actually the accomplishment of the time-critical diagnosis certifications, our trauma certification, our stroke certification, and our STEMI certification for our Level 3 designations for our emergency department.
You made some changes, too, in the ER, have you not?
Yes, we
recently.
Have. Yes. So the time-critical diagnosis, we started working on that early in my tenure when I came as chief nurse. I think it's really important that you, in a small community and rural community, time-critical diagnosis is important because you have to be able to care for patients that have those diagnoses that need care immediately and can't wait for a 45-minute ambulance ride. Yeah. So that's important, have the good quality. So we worked really hard on quality. In the last year, we've been working even harder on the throughput for the emergency department. Obviously, wait times are a hot topic for anybody across the country when they go to an emergency department. So we've been working really hard on the throughput for that. So we've been doing some lean processes. We've had a process improvement team working on improving the throughput by implementing fast track rooms. So we have 5 fast track areas now, and a nurse practitioner sees patients between the times of 11 and 11. And so they begin the protocols and the care for the patient in those fast track areas without having to go to the back into the main ER areas. Mm-hmm. So we have had some significant wins with that. We've increased our satisfaction scores compared to our Press Ganey is our surveying company that does that across the nation. It's a large group of hospitals that we compare with. For February, our satisfaction scores were in the 80th percentile compared to other hospitals for our overall satisfaction, which is really, really good for us. So we were really proud of that. But I think it largely goes to we have been seeing about 30 to 40% of our patients have been going through that fast track process, which the goal is to see those patients in about an hour and a half. So door to door, come in, get treated, and out within an hour and a half. And you can imagine how pleasing that is to patients that they're not waiting the usual 3 to 4 hours to be seen door to door in an emergency department situation.
Nothing will upset a patient more than having to sit there and just wait, right?
Absolutely.
That'll get their attention more than anything.
Absolutely.
It's not good when that happens, is it?
No. So the waiting is really the waste that we try to lean out of that. So getting patients to start the protocols quickly, seeing the medical professional quickly. So that's what we've been focusing on. And then now we're also working on the processes once they get in there. So getting those lab results back quickly, getting those radiology exam results back quickly so that we can get to a diagnosis as quickly as possible. That's the process that we're doing right now. And we've done that really efficiently with those time critical diagnoses. For instance, we have a stroke protocol, which we have numerous examples of patients that we've been able to literally save their lives. But when you have a stroke patient come in, we have a protocol where they go straight to the CT scanner, they get scanned, we get those results back within 10 minutes. We get we get them called to the neurologist. We know whether to give medications. So they get like door-to-needle TPA, which is the clot-busting drug, really quickly on the road. Within 45 minutes, we're doing everything we can. I think those processes have helped us learn how quickly we can get to diagnosis and how quickly we can treat and how quickly we can turn around radiology exams. So those are the things that we're working on with just our normal general public patients to make sure that we can get people through as quickly as possible.
Is one of the things you try to do too is keep people from abusing the ER? Isn't that's a problem in most hospitals, isn't it?
Well, I think that patients come to the ER because so they work during the day. They can't miss work. I mean, I'm actually so I'm still a nurse at heart. So I'm pretty forgiving. I'm a pretty forgiving person, and so when some people might see it as abuse, but I think that people come to the ER not because they want to sit there for 4 hours, but because they need to be seen. They need an antibiotic. They feel like they're sick. They don't have time to take off work to go to the doctor to take their kids. So they come when they can, and when they can, what's open? It's the emergency department, and so they come to the emergency department. So I think that is why greater than 50% of our patients probably are those lower level patients that probably could be seen in urgent care or a physician office. Yeah. And in order to combat that, that's why we do have our express care, which is open till 8 at night.
That does help you, though, doesn't it?
It does help. It has not decreased our ER patient volume at all. Not hasn't. One bit. Which means patients really do need that extra availability, honestly. So people, probably before express care was open, people were either waiting or not seeking the care. So having that access is important. Our primary care offices, too, as you know, our WMMC network of physician practices, we have open access every single day. We have access available every day in every one of our practices for appointments, same-day appointments. So we've worked really hard on that in the last 2 months so that every day people can get a same-day appointment in every single practice. It may not be with your physician, but it's someone in that practice. Yeah. And then because even express care is full. And so the whole intention of that is if you're a patient of Dr. Dave Glover's, for instance, and you go to express care is getting really busy. So people are waiting at express care. So it's not very express, as I've heard. They're like, this is not very express. So what we've done as a system is try to look across the system. So now the people that work at express care, they know that Dr. Dave Glover's office has 22 openings today, for instance. Yeah. And so they can say to patients, we can get you in over at Central Family. So we know across the system where the openings are. And so every single office, we identify how many openings every office has. And so that same day access is really important to us because patients, we don't want them to have to use the emergency department. It's a very expensive mode of care for them. It's expensive for them, it's time consuming for them, and it is for us and the healthcare system as well.
I'm going to go here for just a moment, too. I have heard, too, that you've pretty much got the billing problem straightened out.
We are
working on it.
Where's the wood? Where's the wood, Woody? Where's the wood? Right very close. So we did get a new clearinghouse, which is the scrubber that scrubs so after the clinical people put in the data, the charges, and then the coders code it, and it goes straight through to go through the clearinghouse to go to the payers. It used to be, we send 21,000 claims every single month, and about 1% of those would go clean through to the payers. So what that means is 99% of 21,000 claims our billers were having to hand touch a month and correct and fix modifiers or fix the codes or fix various different things. So you can imagine the time that took them and the delays. And so we wonder why all of us were getting bills that might have been inaccurate or very delayed. Well, 99% of 21,000 is a lot of bills that were being hand touched. Yeah. And there's a lot of room for error in that. So now we got a new clearinghouse that started November 14th of 2017. And so we put lots and lots of work. It took us, I think, 4 months to get that implemented. And now about 75% of claims are going straight through. So they're clean. They're coming out of the system correctly. They're going straight through to the payers. And so they're getting processed much quicker, and it's allowing us to get bills out the door quicker and cleaner, more accurate, so that's the whole intent, is to have a timely, accurate bill for the patients so that the patients get their bill timely, which is very irritating, we understand, and it's accurate and timely, but then also that we're getting an accurate and timely payment, which is important to the hospital as well. So it is very close, but we are doing lots of cleanup, obviously, still on some of the old stuff that wasn't as nice and tidy as we would have liked. So,
well, when you're dealing with computers and software and all that, things happen, don't they?
But going forward from November 14th, we have the plan is going well, and so we are feeling good about the future with it. So,
okay, if people want to find out more about the hospital, what's available, and I know you keep adding things all the time.
Well,
is there a place they can go to see what is available at Western Missouri Medical Center?
Absolutely. We have a we have a really nice website. Tara Carlisle, our Director of Marketing and Foundation, she does an excellent job. So we do have a new website that's been re-engineered, WMMC.com. It's a really nice website. It shows all of our services and really gives you some nice pictures and tutorials of things that we do, but also gets you to some blogs and some other question and answers, frequently asked questions. It also gets you in contact with me or other people if you have billing concerns or any questions or about any of our services. So that's really the best way to get to us. And then if you need somebody in person, there's lots of links on there that you can click that direct email us.
You know what? I had to go over to the hospital recently to get some blood work done. I couldn't hardly find a parking place. Now, I'm not complaining about that. I'm just thinking there are so many people working there, and there for whatever reason, it's unbelievable.
We do have a little bit of a parking issue. So that is absolutely true. We have talked with our volunteers about, off-site parking, valet parking. So there are some innovative things in the works because it is a problem when we want to make it easy for people to be able to run in and get their blood drawn. We don't want our staff to have to walk, 6 blocks to get into the hospital. That's not a very pleasing place to work, but it is something that we constantly battle.
Well, I've always been able to find a place to park, but I mean, I was just surprised by. First time I'd been around behind to the east side there with all those parking, it was almost full.
Yes. Well, we moved Bone and Joint into the medical office building in August of last year, which brought with that a pretty good patient volume that is parks there by the medical office building. So that's a new patient volume that is parking there. Our employees do park on the southeast corner. It's a pretty big parking lot. We do have 550 employees.
That's what it is, 550?
Yeah.
And then how many people are there visiting or needing help?
Yes, there's a lot of people visiting, and we have students that come through. We have we have a lot of traffic that come through there, and that doesn't include we have visiting physicians. So our St. Luke's group, they have their own employees that come. So there's just a lot of people there working every day. So it's a busy place.
Do you use students, interns?
We do. We have nursing students. We have shadow students that come through that shadow different areas in the operating room. We have LPN students. We have RN students. We have medical assistant students.
Learning going on all the time, then.
Absolutely.
Most hospitals, I guess, have that. What's next?
What is next for us? Honestly, we are still working really hard to... with our UCM, the exclusive provider organization contract that we have with UCM, we're working really hard with all of our primary care practices to fine-tune those processes in order to give the best quality care for the lowest cost. The real intent behind that is that we want employees, so community members in this community, to get really good health care, preventative care, treatment for their blood pressure, treatment for their diabetes at the lowest cost possible, but also so that the lowest cost for the employers, because we will attract businesses to this community if we can offer a low-cost solution for health care in this community. And so we're working right now on a pretty robust, it's a big palette of services for occupational health and employer-based services that really span from the very beginning. So preventative health screenings, which we already do. We do health fairs at lots of different businesses around town.
Yeah.
So all the way from health fair screenings to helping manage employees' health records and help manage some of their claims data, all the way to becoming their exclusive provider organization like we are for UCM, and work comp management, occupational health screening, those kinds of things. So that's really that's the next big thing. But I think it's going to help our community with things like bringing big businesses like Dollar Tree, because if we can prove to businesses that we have a good healthcare provider here locally, that can help reduce costs, because healthcare costs to an organization, it's a big deal.
Yeah. Thank you for coming today.
No, thanks for having me.
Sharing some of this information with us. I know I was interested in finding out a couple of things, and I know a lot of our listeners are too.
Well, thank you. Thanks for having me.
Darinda Reberry, who's the CEO at Western Missouri Medical Center, guesting with us on Johnson County Today.
Spring is
County Today.
Spring is
County Today.